Hi students, I am Dr. Badrinath. In this video, we will see the androgens. It is a male sex hormones. Okay, androgens. So here I used the emoji of a adult male with mustache. So mustache, beard, all this comes from the androgens only. Androgens are the hormones. Okay, male sex hormones. Okay, with the help of that, so the male characters will come, right? Okay, here what you have to keep in your mind, gen means generator, generation, new things will come. That's why it is related to sex hormones. New generation will come. Okay, like that you can remember easily, right? Androgens. This is your syllabus of pharmacology. Pharmacology of drugs acting on endocrine system. Here you can see the point which I highlighted with the reading, androgens. That is today's concept. In the next video, we will see anabolic steroids. Okay, here in this video, dedicatedly, we will focus the androgens, male sex hormones, where these androgens will come. Androgens comes under the classification of steroids. Androgens are nothing but a steroid. See, steroids are the hormones, okay, which consist of a basic steroidal ring. See, ring A, B, C, D is there. It consists of a 17 carbon atoms here. All these are the carbon atom junctions, 17 carbon atom, all the steroids basically consists of a steroidal ring, all steroids. Steroids are divided into two categories. Corticosteroids, which I have already completed and uploaded the video. Corticosteroids, you just watch it. Next is androgens. Okay, androgens consist of a 19 carbon atoms, two extra than this. Two more carbons will come and attach to the steroids. Then you can say it is a androgens. Whereas a corticosteroids, glucocorticoids and mineralocorticoids both comes under the corticosteroids. It consists of a 21 carbon atoms. See, here it is 19, 20 minus 1. Here 20 plus 1, 21. So 1 is minus here, androgen, 1 is plus. Okay, so say there is a simple technique also to remember this 19. Androgens A first alphabet. That's why here first came. See, A 1 came. So alphabet number 1. Like that you can remember 19. Here corticosteroids. C alphabet number 3. If you total add here 2 1, it become a 3. 2 1 21, like that you can remember. 20 is a round figure that you have to keep in your mind, right? Okay. Yeah, here females consist of a XX hormones. Males consist of a XY hormones. Very important bit. Okay. See, always females, they will give X chromosome only. Okay, so that's why don't blame the wife, your wife. If she pregnant, become a pregnant and she delivered a baby, don't blame your wife. Okay, because all husbands are playing, there is a lady born, lady baby born, like that. Don't say like that. Okay, see here, that's why I wrote here, don't blame the wife if she delivered a female, because Y chromosomes are always in the female. If you are giving a Y, then male will come. If you are giving a X, then see here, lady will come. That is a lady baby will come. So see here, XY in the sperm, that is in the male. If X, see, you are giving a either X or you are giving a Y. If you are giving a Y, you will get a male baby. If you are giving a X, you will get a female baby. However, ladies are having a XX only. So they will give X hormones, chromosomes only. Okay. So keep in your mind, XY is a gents, XX is a male, female, XX is a female. And this is a symbol of the woman, plus 0, plus here 0 arrow mark is there. That is for the men. Testosterone is the main hormone in the androgen. Main hormone, what you have to keep in your mind is the testosterone. See, first keep in your mind, androgens are defined as the substances which develops a secondary sex characteristics in castrated, that is a testis. Having a male having a testis is called as a castrated male. Androgen secondary sexual characteristics are developed like a beard, voice change, okay, mustache, okay, like beard, all this comes under secondary sexual. Here I have shown testosterone is main androgen, mainly responsible for the body hair growth, like HS on the hair, voice breaks, muscle growth. Okay, all these will be increased. It comes under the secondary sexual characteristics. Androgens are classified as a natural and synthetic. Number of times it was appeared in the question paper for this competitive examination. Which hormone is synthetic? Which hormone is natural? Like that, number of times it was appeared. These things you have to learn. First one is natural, which is produced by the body. Testosterone, dihydrotestosterone. Actually, testosterone in our body is converted into dihydrotestosterone. That's why both I have shown as a pair, because both are same, almost same, just conversion is same, same actions, everything is same. That's why I have shown the same color I used for both of them. And dihydroepiandrosterone, androstenedione, these two are also having a same characteristic. That's why that is also I have paired. These names you have to by heart. Androstenedione. Okay, next last one is androsterone. Androsterone, that is the last, it is a separated, it is a metabolic product of the testosterone. I will explain in the next coming slides. Okay, synthetic hormones, methyl testosterone. See here, testosterone is there, here methyl, you have to add a methyl, it is which is produced in the laboratory. Fluoxymesterone, fluoxy, testosterone undecanoate. Undeca means 11, deca means 10, un means 1, undeca, okay, 11. And master alone, like that you can remember. Master alone, Mr. alone, like that you can remember. Okay, this you have to by heart, very important for competitive examination. Testosterone is also called as a testicular hormone because it is produced in the testis. Very important bit. Okay, testosterone name itself indicate it is produced in the testis. In the testis where? Again there was a question. This is also very important. Leydig cells. See, this is the main. Here, see my cursor. Leydig cells. These Leydig cells here, you see my cursor here. These are the Leydig cells responsible for the production of the testosterone. It is one of the important main androgen hormone. Okay, and this where this lady it is an interstitial. This is a testis. You can find here. It is a testis. It is a cross section. If you see, it comes in the anatomy. If you cut this cross section, here you can find the seminiferous tubules like this. Here, this is a seminiferous tubules. Okay, between the seminiferous tubules, here you can find a small cells. It is called a Leydig cells. And this is by intestinal Leydig cells. Leydig cells are very, very important. Dig the earth, like that you can remember. Okay, digging. And daily secretion is 5 to 12 mg milligrams. Okay, daily secretion. And plasma levels of the testosterone is 1, 0.3 to 1, number 1, like that you can remember. Okay, microgram per deciliter. Yeah, testosterone is also secreted by the females. Small amount, very, 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 very small amount. So don't get confusion. Testosterone is mainly for the men. Okay, also some quantity. So don't think that it is a zero. See, testosterone secretion is in adult female also happened. Corpus luteum. This is the structure of corpus luteum. Where this corpus luteum will be there? It is in the ovary. See here, in the ovary there will be a development of corpus luteum. Okay, that corpus luteum, that is another part, another anatomy. It comes in that corpus luteum and adrenal cortex gland. Adrenal gland is on the kidney. Both will secrete the in which this testosterone. Plasma levels consist of a very small amount. If suppose in the females there is a more amount of testosterone, it will become a problem. That problems we will see. Testosterone first we are observing. So I told no, testosterone is converted into dihydrotestosterone, DHT, not DTH. DTH means direct to home. Your TV is there, no? Those who relay the channels, various TV channels, direct to home. This is just reverse of it. DHT, dihydrotestosterone. See here, this is by the enzyme. This enzyme, in number of times it was appeared. 5-alpha reductase. 5-alpha reductase is the enzyme which converts the testosterone into dihydrotestosterone. Cholesterol is the starting material for all the hormones. Number of times I have already told cholesterol. Cholesterol is converted into pregnenolone. These two are the precursor. Cholesterol is the parent, father of all hormones, androgen hormones, steroids, all steroids. Okay, so here you can see pregnenolone, pregnant alone, like that you can remember. Okay, so okay, so one lady is there, pregnant, she was in the room alone, like that you can remember, pregnenolone. Okay, and these cholesterol converted into pregnenolone, and here you will get androgens. See here testosterone, how this, so 17 alpha hydroxy pregnenolone, and it is converted into, or this one also progesterone to this, like that. So many ways are there. This is one way, this is another way. Okay, totally finally you will get a testosterone. Testosterone is nothing but androgen. Regulation of the secretion. See, testosterone is secreted by the testis. Here I see here testis. This testis secretes the testosterone. But you keep in your mind, luteinizing hormone, follicular stimulating hormones are the responsible for to stimulate the testis. Okay. See, anterior pituitary gland will secretes the luteinizing hormone and follicular stimulating hormone. Okay, it is secreted by the pituitary gland. This stimulates the testis. So in the testis, Leydig cells, okay, secretes the testosterone. The testosterone is converted to the estrogen also, estradiol. See here, estradiol. Suppose say in the body, in the blood, there is a higher amount of testosterone. It gives a signal to the pituitary gland. Why unnecessarily? I am always available there in the blood. I am sufficiently is there. My concentration is sufficient in the blood. Why you are unnecessarily preparing releasing the luteinizing hormone, follicular stimulating hormone to stimulate the testis? So don't stimulate like that. It suppresses and this is the secretion. Negative feedback mechanism. This is called as a negative feedback mechanism. See here, this is a very, very important bits are here. Luteinizing hormone influences the testosterone secretion. Secretion. That point very, very important. Testosterone secretion by the luteinizing hormone. High testosterone inhibits the luteinizing hormone. It goes back, negative feedback mechanism. Okay, I am already there sufficient. Why you are unnecessarily stimulating like that? Next is FSH, mainly responsible for the promotion of spermatogenesis. See, don't get confusion. Luteinizing hormone, testosterone secretion. Here it is a spermatogenesis. Sperms will be there, no? That sperms will be generated by the response, promoted by the follicular stimulating hormone. That is also in Sertoli cells. Very important bit. Spermatogenesis will be occurred in the Sertoli cells, not Leydig cells. Okay, Leydig cells secretes the testosterone. Sertoli cells secretes the sperm. Sperm is different, testosterone is different. Testosterone is a hormone. Okay. Inhibin. Inhibin is a protein which is secreted by the Sertoli cells, inhibits the follicular stimulating hormone. The name itself indicate inhibin, inhibition. Okay, it is a protein secreted by the testis only, Sertoli cells. Okay, Sertoli cells, spermatogenesis is there, as well as the inhibin is also there. Yeah, testosterone functions, number of functions. N number, your brain will not sufficient to keep all the testosterone. So many are there, many number of. Mainly you can see your body, see total body, entire body, mind, sexual function. Here three I have shown. All these three, see body, mind, soul, next generation, that is a sexual functions. All these total. Okay, it will be a number of actions will be there. See here, anabolic. What is anabolic and androgenic? Number of students are confusing. Anabolic is nothing but a steroid actions on the bones and muscles. Bones and muscle steroid actions. Here, androgenic steroid actions on the sexual organ. Steroid actions is called as androgenic. See, here I have underlined genic. Genics means sexual organs. Anabolic, B is there, bones. You can keep like this, bone and muscles. Okay. So main four functions I have given. Number of functions are there. We will see in one by one. Mainly sex organs, secondary sexual characteristics. Name itself indicates it is androgens are nothing but a secondary sexual characteristics. Testis, development of a testis, skeleton and muscles. That is called anabolic. I told no, B stands for bone and muscles. Okay, anabolic. Erythropoiesis, blood generation. See, blood generation also depends upon the testosterone. Yeah, here this I made a full shortcut, but all the points I have covered. This is the very important thing, and here you can see all the images so that you can keep in your mind this image is I have collected this one from pharmacology Tripathi book only. Testosterone, here see, testosterone will be converted into DTH, direct to home, dihydrotestosterone, like this. These are the actions. See this side. All these are the actions of testosterone. Pituitary gland, luteinizing hormone inhibition. Just now we saw in the last slide. Testis, spermatogenesis, and genitalia, internal genitalia. Okay, epididymis, testis parts. These are the testis parts. Epididymis, vas differences, seminal vesicles, development in the fetus. Okay, in the fetus itself, starting. This is the internal genitalia. And erythropoiesis, blood generation, very important one. Testosterone, here you can see the blood. Here you can see the spermatogenesis, testis. Testis, here I have mentioned the testis. Voice change, here vocal cord. Erythropoiesis, here this is erythropoiesis, and spermatogenesis. Okay, bone and skeleton muscles. See here, bone, skeleton muscles. Both I have shown. This is the action of both dihydrotestosterone. That's why double arrow mark is there. Here also arrow mark, here also arrow mark. And dihydrotestosterone, external genitalia like a scrotum. This is also very important. External part of the male sex organs are the scrotum, penis, male urethra, or the dihydrotestosterone. Internal genitalia, here you can see internal, that is a testosterone. Okay, penis, male urethra, formation of the fetus, and maturation during the puberty, like this. All this prostate gland, very important. Prostate gland, dihydrotestosterone. Okay, and hypertrophy, edema, hair follicles, hairs. See here, that's why here on the scalp I have shown, no, and hair loss in the adults. If there is more testosterone in the male, more hair loss will be there. It is a reverse of it. Okay, initially there is a growth will be there, but later what happened when he become an adult, and hair will be loosed. Okay, and aggressiveness. This is a mind, our body. Testosterone is having a mind. It having, see here, mind. How it controls the mind, testosterone? Aggressiveness will come. See, when you become adult, you are always try to fight with others and try to solve the problems always with, not with mind, only with fight, like that we thought. Okay. Testosterone mechanism of action, androgen receptor. Receptor is there. That receptor you have to see, this is an anabolic steroid indicated by the A. It reacts with the hormone receptor R in the cell membrane, and it enters into the as a complex in the cell nucleus, and it acts on the DNA, formation of a new protein here. DNA, tRNA, mRNA, that you know very well, production of the proteins will be there as per the that genetical difference. That's why the body will come like that. As a father, the child will come. Okay. And testosterone pharmacokinetics, if you see, oral route is a very inactive. See, testosterone tablets are available, but don't take the testosterone without doctor consent. If you have a deficiency of testosterone, then only you have to take. Doctors will prescribe you. Otherwise, you should not take extra testosterone. Not at all necessary. It is very dangerous, highly dangerous. Okay. So very inactive. Why means because it is a first pass metabolism, that you know very well concept. Testosterone will be destroyed in the liver, in our body. That is called a first metabolism. Main biggest side effect of the oral route, the first pass metabolism. Okay, IM injections are very good, short duration of action. Plasma half-life is 10 to 20 minutes. Within a 10 minutes or 20 minutes, whatever you have taken a testosterone, it will become a half. 10 grams, it will become a 5 grams. 5 grams, if it become a 2.5 grams. Like that, half-life go on reducing. Here you can see the testosterone undecanoate soft gelatin capsule. Okay, this looks like a soft gelatin capsule. Here testosterone propionate injection. Here you can see injection also available. IM injection, oral route, testosterone hormone is available. But without concern, you should not be taking. Testosterone having a lot of side effect. See, in the females, if there is a more testosterone secretion, I told very small quantity in the testosterone will be there in the females. Now, testosterone, if it is a more, they will get a like a mustache, okay, and male pattern. See here, virilization, very important bit. Virilization, male pattern hair growth in the female, like this. Bad, they will get a bad mustache. All this comes in there because of the testosterone, because they have excess testosterone in their body. Okay, and menstrual irregularities in the woman, that is also it causes. And acne, this is acne, like the pimples. Acne is nothing but pimples. If you touch, you will get a small little bit of pain. Okay, both in males and females. Acne, it is nothing but secondary sexual characteristics. Okay, testosterone, painful erections in the male. Okay, that's why. And oligospermia, spermatogenesis will be decreased if you are, if that is a main side effect of the testosterone. That's why you should not supposed to be take extra. If you are taking extra, sperm count will be reduced. See here, oligospermia. This is oligospermia, it is called. See, this is a normal count, sperm count in the male. Okay, here you can see reduced. Testicular atrophy. See here, shrinkage of the testicles. Here you can see this is the normal testis. Here you can see shrinkage. Just like a cloth, if you put in a cold water, it will become a shrink. In the same fashion, testis also will become a shrinkage. That's why don't take extra testosterone. It becomes a reverse of it. Hormones, don't play with hormones. Very dangerous. And testosterone, if it is a more in the body, directly they will become an adult. That is the main problem. Precocious puberty, child body changing to the adult. Adult means puberty. Okay, too soon, very early. Here also I have mentioned the age also. When puberty begins, puberty means become adult. Before the age of 8 in the girls and 9 in the boys, then you have to consider it as a precocious puberty. It is very dangerous. Premature sexual behavior. In the 6th class itself, they will get married because of the hormonal problems. Not love give, nothing is there. No, nothing, no love, no nothing. Only hormones are working. That's it. Testosterone, salt retention is there. See how in the body edema, it will leads to salt retention and edema. See how the swelling is there. Here pit formation will be there. If you press that, if you press the skin, no, small pit will come. Okay, it retains for 1 or 2 seconds, 2 seconds, 3 seconds, like that. The pit will be like that. So it will become a normal after 3 to 4 seconds. It become a very dangerous position. Edema is there. That's why testosterone should not take extra. Cholesterol, jaundice also come. Don't take extra. Your eyes will become a yellow. You know, jaundice, very dangerous thing. And the testosterone leads to gynecomastia. Gynecomastia. What is gynecomastia? Number of times it was appeared in the question paper. Competitive examination, MD entrance, MBBS entrance, all the entrances, M.Pharmacy, B.Pharmacy, nursing, MSc nursing. Gynecomastia. Breast in the male, like this. Breast formation in the male. This is called gynecomastia. And hepatic carcinoma, cancer also come. Carcinoma is nothing but a cancer. Like this, your liver will be like this. See how this one, how the liver. Testosterone uses. When you have to use this. See, testosterone in the male body, if it is a less, then only you have to take. Don't take extra. See here, male infertility, inability to do pregnancy. Hypogonadism. Hypogonadism means diminished functions activity of the gonads. Gonads means sexual glands. Okay, sexual organs called as a gonads. Testicular failure. All three are same, almost same, not exactly same. Male infertility, inability to do pregnancy. Male infertility. Hypogonad. Hypo means less. Gonads means sexual organs. Okay, testicular failure. Testicles will be failure, unable to produce the sperm. So he will become a male infertility like that. AIDS related muscle. See, it builds up the muscle. Testosterone builds up the muscles and bones. So in AIDS, what happened? Muscles will become weakness. Bones will become a weakness. In such a cases, testosterone is useful. Doctors has to give a testosterone in such a condition because testosterone builds up the muscle, builds up the bones. Okay, in AIDS, body will become like a lean, muscles will be dissolved, bones will be dissolved, slowly dissolving. Okay, aging and heart problems. In the aging, bone mineralization. If you want to become a strong bones, testosterone they will give. Doctors will give. Don't take yourself. This is the weak androgens. Number of times it was also appeared. These are all the weak androgens produced by the, see here, dihydro. This is what we saw in the first slide, classification slide. Dihydroepiandrosterone, okay, androstenedione produced by the adrenal cortex. This is the gland, adrenal gland. Here you can see adrenal cortex. It is a middle part. This part is divided into three parts. Zona glomerular. Okay, total three is there: capsule, medulla, adrenal cortex. Three parts. Adrenal cortex is again divided into three parts. 1, 2, 3. Okay, produced by the adrenal cortex, secreted in a small quantity. Weak androgens. What are the weak androgens? These two names you have to keep in your mind. Okay, partially it is converted into testosterone. That's why it is called a weak androgens. Only a small quantity will be converted into testosterone. Androsterone, last of the natural hormones. Okay, metabolite of the testosterone. Metabolic product of the testosterone is converted into DHT. Both testosterone and DHT will become a metabolite, small breakdown part of the adrenosterone. That is called adrenosterone, excreted in the urine. Activity is only 1/10 of the testosterone. Very important bit. Synthetic androgens, this side Usanos, natural, synthetic. These are the master alone. See here, master alone, testosterone undecanate, methyl testosterone, fluoxymesterone. All these are the, you can take all screenshots, you can be take. Okay, all these are the orally active. Three. See here, this is orally active, this is orally active, this is orally active. Oil injection is available. This is also appeared a number of times. Testosterone undecanate obtained in the form of oily injections. Pharmacokinetics of this synthetic synthetic hormones, synthetic androgens, methyl testosterone, fluoxymesterone, long duration of action, slow metabolism, weaker androgens. Okay, here weaker androgens we saw, no? Weaker androgens like that. Okay, anti-androgen drugs, which works against the androgens. Androgens are the male sex hormones. See, if male sex hormones are more and more, you have to take a reverse of it. You have to suppress it because the child itself is, see how bad will come. Number of times this was appeared. It is also called as a impeded androgens. It works against the androgen. When this has to give excess of the male sex hormones is there, then you have to give a anti-androgen. Number of times it was appeared. Danazol, this is a capsule. Danazol, so easily you can remember Danazol, this capsule. Okay, see here you can see Cyproterone Acetate. Okay, Flutamide, see flute, just like a flute. Flute we use, flutamide. Okay, Finasteride. See fine, like that you can have fine steroid, flute, like a Citirone. Okay, Cyprop, like that. Bicalutamide. Okay, film coated tablets are. See, when you have to give in such a cases, you have to give a treatment with anti-androgen. See, this fellow, this boy, having a over excess of a testosterone in the childhood itself. Androgens are more. Then you have to give anti-androgen. This bad, you have to, doctor has to remove the bad with the help of hormones. Then these drugs you have to use, same drugs. Danazol, same drugs only I mentioned here. Danazol mainly using for the suppression of the luteinizing hormone, follicular stimulating hormone, so that automatically testosterone production will be stopped. Inhibits the steroidogenic enzyme. Cyproterone acetate. See, excess growth in the hair in the female. See, this is a lady. See here how the beard coming, slowly beard is coming. In such a cases, virilization in the woman. What you have to give? Cyproterone acetate. Especially for females, you have to give. Because if they have a testosterone more, then only you have to give. Flutamide, cancer of the prostate gland. Because prostate gland, it is a male sexual gland. Okay. And female hirsutism, okay, benign prostate hyperplasia and finasteride, like that you can be. So I will end my session here. Okay, in playlists I kept all the videos.